Hello guys, today we go forward and talking about academic medical history in surgical clinic, the method of examination of a patient with surgical disease. Lection is big, but it's very important because how I understand nobody uh, understand how you need to prepare the history of the patient and what important things we have there. When treating a patient, information gathered by any means can cru- crucially guide and direct care. Many initial encounters with patients will include asking the patient's medical history, while subsequent visits may only require a review of the medical history and possible in update with any changes. A medical history can reveal the relevant chronic illness and other prior disease states for which the patient may not be under treatment but may have lasting effects on the patient's health. The medical history may also do differential diagnosis. In general, a medical history includes an inquiry into the patient's medical history, past surgical history, family medical history, social history, allergies, and medications the patient is taking or may have recently stopped taking. A complete medical history includes a more in-depth inquiry into the patient's medical issues, which includes all disease and illness currently being treated and those which have had any residual effects on the patient's health. A surgical history to include all invasive procedures the patient has undergone. Family history is another aspect of the patient's medical history with potential indicators of genetic predisposition to disease. Social history is a broad category of the patient's medical history but may include the patient's smoking or other tobacco use, alcohol, and drug history, and should also include other aspects of the patient's health including spiritual, mental, relationship status, occupation, hobbies, and sexual activity or pertinent sexual habits. This may require further questioning if there is a concern for health risk or any relationship to the acute disease state. Patient allergies are a crucial aspect of history gathering as these may have potentially life-threatening consequences. It is critical to always ask clearly if the patient has any medication allergies and if they do, clarify the reaction they had to the medication. Medication history is also important as patients take more and more medications and drug-drug uh, interactions must be avoided. Other areas of the history may be obtained on a case-by-case basis. Age and gender will often guide the interviewer in when to obtain these further histories. Parents of infants should be asked about complications of the pregnancy, delivery, and prematurity. Also, parents of pediatric patients should be asked about the immunization status of the patient. Immunization status for adults and geriatric patients is often relevant. With more vaccination options, this may become a standardized aspect of history taken by practitioners. Asking female patients age-appropriate questions about their last menstrual period and their pregnancy history to include gravidity on parity should be common practice. According to the patient's age, further questions about menarche and menopause may be appropriate as part of the medical history. Issues of concern. The primary goal of obtaining a medical history from the patient is to understand the state of health of the patient further and to determine whether the history is related to any acute complaints to direct you towards a diagnosis. The secondary goal is to gain information to prevent potential harm to the patient during treatment For instance, avoiding medications to which the patient has an allergy or avoiding administering or prescribing a medication the patient has previously taken and had an adverse reaction. Often, information from the history can direct treatment or may indicate a need for further workup of patient complaints. The history may also inform the provider of certain aspects of the patient's health which will direct care, especially avoidance of potential harm. Especially avoidance of potential harm to the patient with regard to allergies or previous treatments, limiting care at the time of the encounter. Family history may help risk stratify patients with conditions with genetic links. A key area of concern is the patient's health literacy and how the questions to obtain the histories are asked so the patient understands and can give the appropriate answer. Often patients will not regard their chronic illness when asked about medical problems, especially in acute treatment settings where their patient may not realize the significance or relevance of the chronic disease. In some instances, a question may need to be asked in multiple ways to acquire the necessary information adequately. Another concern about asking questions of this nature is it may concern the patients about the physician asking personal questions and may withhold information for fear of judgment or legal consequences. Patients should be reassured the information is gathered in an effort to best find the cause of their illness and treat them in the most effective and efficient manner. Once this information has been obtained, it should be treated with care for the patient's privacy under laws such as the Health Insurance Portability and Accountability Act in the United States, for example. Clinical significance. Patient medical history is often a crucial step in evaluating patients. Information gathered by doing a thorough medical history can have life or death consequences. In less extreme cases, medical history will often direct care. An example of a patient with a history of breast cancer on chemotherapeutic drugs with a cough may show a need for further workup of a patient with an immunocompromised state versus a healthy patient with no chronic disease. Documenting the medical history can be life-saving as well. An encounter with an awake patient who is able to answer all questions, which are subsequently recorded on the electronic medical record, could prove to have vital information in the event the patient's mental status change, or during a later encounter if the patient is unable to give their history, such as in traumatic accident. Those who get a medical history in the acute treatment setting may not have the time or opportunity to gain a complete medical history. In these cases, focus should be primarily on the most relevant and pertinent history. If a patient requires emergent treatment such as threats to life, limb, or sight, the physician may forego asking questions about the medical history until after the immediate threats have been addressed and stabilized. Yeah, general surgery more often it is about the emergency situation, and of course we're not often talking about the family uh, history, about the social history, because we haven't got the time on it. But after the emergency situation, it will be a normal situation, and in this situation, we always can take absolutely all information from patient. Some instances may allow for a few questions, at which time the three primary questions to ask the patient are about the patient's general and brief medical history, allergies, and medications the patient is currently or recently has been taking. This information is the highest yield for potentially avoiding the medical error of giving the patient a medication they are allergic to or which may interact with the current medication the patient is taking. The complete medical history may be obtained after the patient has stabilized. The family may be a potential source of information about the patient's medical history. When the patient is unsure or unable to answer questions regarding their medical history, this information can generally be regarded as accurate, but you may have similar issues with the patient's family regarding health literacy and understanding. Obtaining through history is important, but the questioning should show empathy to the patient and their condition. Patients may feel rushed or that the provider lacks empathy if questions are asked robotically. Communication the patient's medical history to other medical professionals is important and can have significant implications in preventing medical errors. When recording the patient's medical history uh, in the chat, accuracy may reduce medical errors or improve diagnosis. An accurate medical history will cross through all aspects of the interprofessional team involved in the care of the patient. And now I want talking with you about the example of the surgical history. First of all, we talk about introduction. Yeah, it is the age of the people, it is occupation of people. Uh, Presenting complaint in the next step, symptom, 1 duration, 2 duration, 3 duration. History of presenting complaint. There you need check the quality, quantity, timeline, associated features, risk factors, and complications. Past medical history. Similar problems in the past. Medical history like mechanical. Sorry, I forgot. I will remember it. About jaundice, hypertension, rheumatoid, epilepsy, asthma, diabetes, surgery, or strokes. Jaundice, TB, and MI. Forgot, guys. I will remember. Anesthetic history, general risk factors, stroke, ischemic heart disease, angina, shortness of breath, renal failure, diabetes, change in bowel habit, DVT, PE, woman, last menstrual period, vaginal bleeding or discharge, pregnancies, deliveries. Past surgical history. What patient have in anamnesis? Open surgery, laparoscopy, endoscopy, endovascular procedures, ultrasound, CT, MRI, imaging, surgical fitness assessment, mobility, able to climb one flight of stairs, ability to lie flat, maximum exercises distance, bleeding risk, bleeding disorders, drug history, allergies, regular medications, medication taken signs seem to have started, anticoagulant or antiplatelet agents, recreational drugs, social history, bad habits, smoking, alcohol, home plus 3 others, work, social, personal, family history, relevant hereditary conditions, exposure to any risk factors of acquired disease. And after it, you can talk about systems review of all systems, yeah, and if it isn't already undertaken. The method of examination of a patient with surgical disease. Initially, the patient is given the opportunity to state their complaints themselves. In the future, the curator clarifies the major and minor complaints, clarifies the sequence in which they occurred, and what relationship exists between them. When there is pain, pay attention to the character, intensity, location, and irradiation. It is necessary to clarify the connection of pain with movement, physical exertion, food intake, urination, defecation act, as well as other external factors, hypothermia, change of weather, season. It is important to clarify the duration of pain if they are accompanied by feelings of fear, anguish. In, in severe patients' conditions, you should formulate questions so that the patient can answer in one word. After clarification and detailed complaint, it is necessary to undertake a systematic survey of the patient in terms of the basic functions of the body in a specific pattern. Particular attention should be paid to those violations which may be relevant to the disease. An additional survey of the patient according to the following schema. First of all, you talk about the respiratory system. Yeah, there we identify the nature of breathing, if there are nasal discharge, the amount and type, if nosebleeds indicate their perfusion, duration, frequency, and the cause of the allergy. Detailing pain in the chest states their intensity and location, frequency in connection with which they arise, where radiation. We attach great importance to factors that increase the pain in the chest. Cardiovascular system. If you have complaints about the heart, it is advisable to clarify its nature, frequency, duration, and if possible the causative factors. Pain in the heart may be periodically or continuously of varying intensity and significance of radiation. Important complaints are those of pain in the lower limbs, detailing the complaints of pain in the lower extremities. Pain may occur periodically in the form of intermittent claudication, is often accompanied by increased chillness, feeling of pins and needles, numbness of the limbs. Note the presence of a headache, dizziness, decreased vision, memory impairment. Digestive system. And there I need to repeat you that in neurosurgery more often it is about the digestive system. After asking what the patient's appetite, good, fair, approve of, you should pay attention to taste, bitter, sour, unpleasant, the amount of fluid drunk per day, thirst, salivation, aversion to any food. Most of the diagnostic values are subjective data such as getting liquid food into the trachea, free, difficult or painful passage of food through the esophagus, character regurgitation and its smell. Full transcript of dyspepsia, the determination of their intensity and duration, taking into account the causative factors, an important element in the diagnosis of surgical disease of the gastrointestinal tract. The curator is to imagine the logical sequences. This evaluation specifically focuses complaints of the patient and gives them some praise. For the diagnosis is extremely important, for example, such data when there was vomiting, whether it is connected right to the reception, the amount of vomit, smell, color, and others. When there are complaints of abdominal pain, we need to know their location, character, irradiation, and communication with the meal. It should also take into account the physiological characteristics of the body, carminative, defecation, um, yeah, urinary system. There you see the text, I don't want to read it. Nervous system, the same situation. Musculoskeletal system. After completing the study of the subjective complaints of the patient, it is necessary to detail and, in a certain sequence, to state in history. It should be guided by the following scheme guide. To describe the complaints of the patient due to the underlying disease and its complications. Obtaining the study of subjective data grouped into complaints of a general nature, local and complaints relating to other organs and systems. For example, complaints of a patient with dumping syndrome can be divided into three groups of complaints: general, local, and related respective disorders. Objective research. Of course, you start with external examination of the patient, first describes the general condition of the patient, satisfactory, moderate, severe, agony, his consciousness, clear, confused unconsciousness, and position in bed, active, passive, involuntary. Be sure to pay attention to the expression of the patient, uh, figure, fixed height in centimeters, weight in kilograms, and body temperature. Given a general characteristics of the skin, not the color, turgor, and elasticity, as well as the presence, arrest, the pigmentation, scars, rash, tumors, bruises, especially hair growth, examination of the mucous membranes, connective nose, lips, mouth, and pay attention to the color, the presence of lesions, erosions, ulcers, lack of lacia. Tongue may be wet, dry, and dryish, surrounded by white, gray, or brown coating. In describing the tonsils, determine their color and value, give a characterization of dental formula. Along with the determination of the degree of development of the subcutaneous tissue, note the uniformity of its distribution and skin pastosity or edema. During inspection and palpation of lymph nodes, find out their cohesion with subcutaneous fat, texture, size, tenderness. In the same section, provide data from examination of mammary glands, the symmetry, size, shape, and presence of nipple discharge. On palpation of the prostate, in vertical and horizontal position of the patient, it is impracticable to determine the development of adipose tissue, the nature of labral structure, the presence of cells and tumor formation. I won't tell you that when we talk about emergency situation, we never touch the mammary glands, sorry, not touch, do examination. And we don't do the palpation of prostate. The next step is study of respiratory system, study of circulatory system, investigation of the digestive system, investigation of the genitourinary system, nervous system, endocrine system, and musculoskeletal system. Don't will talk about all of this, but about digestive system, I need to talk with you. On examination of the abdomen, define the shape, part of the front wall in the act of breathing, and the presence of visible peristalsis. In addition, it's possible to detect the visible pulsation on the epigastric region, the divergence of the abdominal muscles, hernial protrusions, strain, and coughing. The method of determining the state of the superficial palpation of the abdomen, its resistance, strain of abdominal muscles, tenderness, and its location, area of skin, hypersensitivity, and pain points. It is necessary to identify and fix the medical history and condition of the umbilical inguinal rings and the presence of symptoms, like symptom Schottky-Domberger. With deep methodical slide and palpation method of Abrastov-Soreska and consistently determine the location, condition, and pain of the sigmoid colons. Second, determine soreness at the points marked Dorney, Lanza, Round symptoms, Titnikovsky, Vakursenia, or Sandy sign, Krimov, Obraztsov, and others. In the same manner and subject to the same data, examine ascending transverse colon, descending colon determines the presence of tumors infiltrates. With deep sliding palpation of the epigastric region, palpate stomach, define pain of individual sections of the small and large curvature, pylora, duodenal region, bulbs of duodenum, ulcer, note the presence of visible peristalsis, infiltrate tumors, deformities, asymmetries. A study of the liver begins with a tour of the lower third of the chest and right upper quadrant, palpation particular edge of the liver and its borders. Exploring the gallbladder, pay attention to its character, volume, mobility, pain, and hypersensitivity zone. In the study of pancreatic area, inspect the epigastric region. Palpably determine the shape, size, and consistency of the prostate. Pay attention to the presence of infiltration, tuberosity, and tumors. In determining the boundaries of the spleen, palpation start with left groin, scrutinize the state of the left side of the abdomen and the left hypochondrium in the supine position on the right side. The history record data from studies on the consistency of the spleen, the surface, and pain. When we view in the anus, note the presence of external hemorrhoids, prolapse of the rectal mucosa, and the presence of warts, fistula, and fissures. At manual study, it is impracticable to determine the tone of the sphincter, the presence of internal hemorrhoids, infiltrates, polyps, tumors. It's extremely important to be considerate in the identification of rectal mucous bleeding. After all of this big scheme, you come into the preliminary diagnosis. Yeah, it is a diagnosis what you can state without any investigations. On the basis of patient complaints, the history and objective examination, as well as the laboratory logical instrument and other additional methods of investigation, reflection the underlying disease, its complications and comorbidities, we can supply the following diagnosis. In order to establish the clinical diagnosis of patients, we need to survey. Plan of inspection. What you need when we talk about the investigation, yeah, or inspection. Clinical analysis of blood platelet indication, urinary disease, analysis of urine, the residual nitrogen, urea creatinine of blood, the contents of potassium, calcium, sodium, chloride in the serum. Key indicators of acid-base balance, general protein and protein fractions, explained calculation, blood group and RH affiliation, the content of bilirubin levels, diastase blood, urine, blood glucose, determination of aldolase transaminases, scan, like CT, determination of the main exchange, test for unconjugated bilirubin, ACG, analysis of gastric juice with histamine load, duodenal intubation, special methods of examination like endoscopy, X-ray, ultrasound, CT. Here there, I need to tell you that it's a big list, yeah, and for any disease you will use something of this. In surgery, for us, it's very important to do 3 steps. First, it is X-ray. Second, it is clinical analysis of the blood, and the third is a sonography. Here, there we have some more: bronchoscopy, cholangiography, cystochromoscopy, sigmoidoscopy, colonoscopy, laparoscopy, and others. But 3, the main, it is X-ray, sonography, and analysis of the blood. After all of this, you go to clinical diagnosis. It based on the above patient's complaints, anamnesis of disease and life, as well as the results of additional research methods. We can put a clinical diagnosis. In justifying the clinical diagnosis, only these studies that were obtained after the description studies that were obtained after the description of the preliminary diagnosis, reflections the underlying disease, its complications and comorbidities are used. Protocol operations. It's more interesting moment in history of surgical patients. Yeah, and there we have protocol operations. They need right a treatment of surgical field, skin incision, particular surgical approach, data audit and inspections body, a detailed description of the detected organ change, the final choice of method of surgical intervention and its rotational sequence of the various stages of operation, a description of any complication during surgery, a description of the operated organ after its reconstruction, a description of the remote organ of or a part thereof, particular transaction, particular closure of surgical wounds. And epicrizis. Why you know about this one? Because it is a section is detailed extract from the case where the surname, name and patronymic of the patient's age when he entered with any diagnosis, conducted survey, treatment, surgery, when issued, and what the final diagnosis is. And for today, that's all, guys. Down under the video, you will see a link for document with example of history of disease. Everybody of you in the practice will do this one. Thank you very much for your attention and have a nice day. Bye bye.